So, feeding is a really important topic in the NICU. I just want to preface this by saying that I personally do not have too much experience doing the actual act of feeding in the NICU. My hospital, we were really lucky. We had occupational, physical, and speech therapies present. So, in that case, speech kind of took on that role of feeding in the NICU. But as an OT, we do have an impact on feeding, even though we are not directly feeding the infant. Working on like their motor coordination and their state control to get them ready for feeding. But if you were to work at another hospital, you might be the one responsible as an OT to provide the feeding. So it is important to have some background education on the topic. Feeding is such an important role for the baby occupation. It's one of their main occupations: eat, sleep, feed, grow. And it's something that you'll find that parents are really can get really hung up on, because you go into your pregnancy just expecting all of those normal, typical activities that a baby would do. So, getting to hold your baby, feed them a bottle, burp them, change them. And when you throw the NICU stay into the mix, it really can throw off the parents' perception of what that ideal world looks like for them. So it's really important to help educate the parents as well and get them involved in the feeding process, even if it's not the direct giving their baby a bottle. But there are things that they can do to help be involved in that experience and then grow throughout the process with that baby. So, feeding encompasses not just bottle feeding. Babies who are receiving their feeds via an NG tube, like you see in the middle picture, or a G tube, or moms who want to breastfeed their baby, or the typical eating from a bottle. All of those are an important part of feeding in the NICU, and one isn't better than the other, but we want to provide a good experience for all of those options of feeding, because feeding is a natural social activity and you have to feed to live. So it really is important to help the babies be the most successful that they can be at that time. And just kind of the long-term effects of feeding from the NICU. So feeding problems that are left unresolved at the time of discharge from the NICU can persist into early childhood and present later on as oral feeding aversions and impact other long-term feeding issues. This includes tactile sensitivity, selective eating, so those picky eaters that we see all the time, and failure to thrive, where the babies or children aren't getting the nutrition that they need. Some staggering percentages that I came across in research were that 31% of the pediatric population who presents with feeding issues are former NICU graduates, and 40% of children who are referred to outpatient occupational therapy specifically for feeding concerns are former preemies. So even if you're not working as an OT in the NICU and you're working in early intervention or even as a school OT, outpatient OT, it's likely that you're going to come across kids who have feeding problems. So it's important to kind of see where the root of the problem is, and it often leads to the NICU. So something that we look at in the NICU is feeding readiness. So this is kind of encompasses their level of alertness. So are the babies able to achieve a calm, alert state where they can interact with their environment? You're not going to try to feed a baby who can't stay alert and awake. Feeding a sleeping baby really just doesn't work. So that's an important sign of readiness. Also, their respiratory and cardiovascular stability. So if a baby is on a really high level of oxygen support, like for example, CPAP, ventilated, we're not going to be bottle feeding those babies. So kind of getting them to the stage where they're able to maintain their respiratory status and also their cardiovascular stability, where they have a stable heart rate. They're not dropping their heart rate when they're trying to eat or overworking their bodies by trying to eat. Babies who have motor stability, so better tone, their posture during feeding, the quality of their movement. These all impact their ability to feed. The suck, swallow, breath coordination. So, are they able to coordinate the pattern to suck on the bottle, swallow, and also to remember to breathe in that process? And you'll find a lot of babies have a really hard time coordinating those movements together. And then also the ability to maintain a temperature in an open environment. So, when you see a baby in an incubator, those are temperature controlled to help babies who aren't able to regulate their body temperature. And then they slowly progress. So they might initially be unswaddled in that, and it's a warmer bed. And then they'll kind of progress to, can they be in the bed with the warmer off, but they're swaddled? Are they able to maintain their body temperature in that? And then they'll slowly try taking the hood, opening the hood of the incubator, and then are they able to keep their temperature maintained with that open environment, and so eventually removing all support. So then our role is to help the baby in developing the skills to self-regulate or move within those systems so that they're ready to feed. So this baby at the bottom is a perfect example of a baby showing hunger signs who's ready to eat and ready to learn. So kind of the stepping stones for feeding are initially oral stimulation and experiences that can be provided. So it's a programmatic approach to provide tactile input to the face, mouth, tongue, lips of the infant. And these can include kangaroo mother care, so giving them skin-to-skin contact. Can they handle that stimulation? Non-nutritive sucking, so this can be either on their hand or on a pacifier like the little one in the middle. And then independent exploration of their face and mouth. So them independently bringing their hands to their mouth, sucking on their thumb, sucking on their hand, kind of figuring out where their mouth is. And then the little guy in the bottom left, that's just nursing will do oral care. So they'll use a swab to either do like breast milk dips to give those babies an experience, the ones who might not be ready for feeding, but can they handle all the sensations of the breast milk, the taste, the smell, the feeling of the liquid, kind of what does their mouth do when they experience that. And then this is just an example of caregiver education that can be provided. It's really important to give like a handout for parents so that they have something to refer to. So this one, for example, is talking about during their care time, talking to them in a quiet, calm voice. And then if they look like they're breathing okay, holding that baby during the tube feeds. A typical baby who's bottle feeding, you would hold them while you're feeding them. So there should be no difference when you're tube feeding a baby to give them that same experience of being held and bonding and getting that comfort while they're receiving their feed. Keeping the environment calm with dim lights, calming sounds, no loud noises. If their breathing looks good, giving light, gentle touch to their face by their mouth, kind of getting them used to having that oral experience. And then if they can tolerate that, providing their pacifier, something they can work on that suck, swallow, breathe coordination. Offering the scent of breast milk and formula with those pacifier dips that we talked about, giving them a taste of that. And then also identifying signs that they might need a break from learning the basics of feeding. So maybe it's too much for them, whether there's gagging or coughing, those stress cues that we looked at earlier, the stop sign, finger splays, facial grimaces, increased work of breathing. So maybe they're working a little harder to breathe. Their heart rate might be a little bit higher. You can kind of tell that they're in a little bit of distress. Or signs where they're getting a little sleepier or drowsy. So they're kind of telling you like, okay, I've had enough. I'm ready to take a break from this. So that was kind of just a quick snapshot of of feeding. But if you guys have any more in-depth questions about anything that I talked about today, I know it's kind of a lot in one presentation to throw at you. Feel free to send me questions. I can provide Mary my email address. A lot of times in previous years, I've gotten questions about students asking how they can get a level 2 field work in the pediatric setting, whether it's like my specific hospital or not. I will say from experience that the hospital that I used to work at, St. Christopher's Hospital, which is in Philly or in North Philadelphia, they do take students, but they are scheduled out pretty far in advance. So if it's something that you're really looking for, you really want to reach out sooner rather than later. The same with CHOP. I'm pretty sure that they take the students pretty far in advance and it's a little cutthroat to get into the program. So just keep that in mind if you're looking to get into pediatrics. And other questions I've gotten in the past are like how to kind of get your foot in the door in working in pediatrics. And I would say try to find a job where you have support. I kind of bounced around my first year and a half of working because I didn't feel like I had the support and the mentorship that I needed. And it really, now that I have it, like I'm almost 8 years out of school, and it makes a huge difference having someone to learn from and someone to ask questions to and to kind of just provide you some guidance, because there's a lot to learn and it's one thing being thrown into things, but it's also nice to have support and know that you're able to learn from other people who have experience in the field. Um, so yeah, if you guys have any other questions, please feel free to reach out. I love giving my experiences and kind of providing support because I felt like I needed that as a newer grad or as a student. So I'm always open to doing that. And thank you guys so much for having me talk in your class, and hope to see you soon. Thanks.